Namaste, this is Dr. Vaishali Ashok Bhide. Today I will be talking about varicose veins. Varicose veins are nothing but distended, dilated veins which are overfilled with blood. To understand the varicosity or varicose veins, we need to first understand a little bit about the circulatory system. Our circulatory system consists of arteries and veins. The oxygenated blood pumped by the heart is carried to different parts of the body by the arteries. The deoxygenated blood in different parts of the body is pulled back together to the heart by the veins. So small veins drain the blood into bigger veins, which in turn drain the blood into still larger veins, and then this blood is returned to the right side of the heart. So basically, as we see it, the veins in the legs have to do a little more work as they have to push the blood against gravity towards the heart. So this is aided by two things. One is the muscles in the leg which act as a pump, the muscle contraction, which helps to pump the blood upwards. Secondly, what we have, which are called as the valves in the walls of the vein. These valves allow the blood which is pushed upwards to flow only in one direction, that is upwards, and does not allow the blood column to get down. So with these two mechanisms, the blood, the deoxygenated blood in the veins is sent to the heart. Now in spite of such a good mechanism, why do varicosities develop? The reason here is, in some people there is an inherent or a developed weakness of the walls of the veins. The walls of the veins are little weak. Because of this, the muscle contraction and the force on the vessel walls is not enough to propel the wall upwards in the same intensity. At the same time, the valves of the vein also become weak, hence the blood which is pushed upwards trickles down a bit. Because of this, a blood column stagnates in the veins, which causes the blood in the veins to enlarge the veins further, and this impacts the circulation even more. So the resultant is, initially the superficial veins start to look spider-like. Later, this problem involves the entire length of the vein, and what you see is blue lines along the entire length of the limb. These are varicosities. Varicosities develop more in females as compared to males, as the vein walls are thinner in females. Pregnancy is a predisposing factor, as the pregnant uterus or the bulky uterus sits on the venous return and hampers the good flow. This condition resolves usually after the pregnancy is over. Obesity and cigarette smoking are other important factors. One important factor is familial traits, that is, if you have a close relative who has varicose veins, then the chance of you developing it are a little higher. Symptoms of varicose veins can be very troublesome. Pain in the legs, especially while standing, is the most important symptoms which brings the patient to the doctor. Along with this, swelling in the legs, and later, as the varicose vein progresses for some time, sometimes a venous eczema develops, which means a skin condition which is secondary to varicose veins. The skin may become itchy, dry, and can ooze a little serous fluid. So these are the three main things. So once we have seen what are the causes of varicose veins and what are the risk factors for varicose veins, let's talk a little about the treatment of varicose veins. The treatment of varicose veins again will be divided into two parts like any other disease. The first is lifestyle management. Second is giving homeopathic medicine. Now lifestyle management strategies are aimed at two things. First is increasing the pumping action to send the blood upwards, and second is prevention of blood stagnation. So in order to increase the pumping action, people are encouraged to go for regular walks. This causes a regular contraction of the muscle and the blood is pushed upwards. Simple leg exercises are given to increase the muscle contractility power. Now, to prevent the blood stagnation, people are advised to sleep with their legs in an elevated position. For example, when we lie down in the night, we have one pillow under the head. These patients are advised to have two pillows under their feet to help drain the blood back towards the heart. Also, they are advised not to stand in one position for a long time. Next, going to the homeopathic treatment of it. In homeopathy, we will take a general case in great detail, that is, first about the symptoms of varicose vein itself, and then the patient's symptoms, that is, his stress, his life factors, his or her challenges, and a medicine is selected. Now, here the advantage is we have a lot of medicine which work on the term laxity. For example, a patient coming to us may have a venous wall laxity, predisposing him or her to varicose vein. At the same time, there could be laxity of the ligaments which predispose the person to sprains, strains, or easy sports injuries. In such a condition, a medicine is prescribed with a common denominator or laxity or looseness. Once this medicine is prescribed, the patient not only benefits as regards the symptoms of varicose vein, but also this tendency to sprains and strains reduces. In case the patient does not have laxity in any other part of the body, then with the full case taking, the symptoms are considered and we have good medicine which act on the vessel walls of the venous system. Clubbing both of them together, a medicine is given. A right medicine given in the right potency with right repetition helps the patients a lot. Over the past 12 years, I have seen around 400 patients of varicose veins, most of them being females, and most of them are living a much better life today. Once the patient is successfully treated for varicose veins, the chance of developing varicose veins again is very less. Currently, I am practicing in Dadar West, Shivaji Park area. My OPD timings are afternoon 1 to evening 7 pm, Mondays, Wednesdays, Friday, at Park Polyclinic 5 Shankar Nivas, Dada Saheb Rege Marg, and on Tuesdays, Thursdays, Saturday, afternoon 1 to evening 7 pm, at Saplace Polyclinic, Malik Building, DV Deshpande Marg, Shivaji Park Road number 4. You can also follow me on YouTube, Instagram, and Facebook. In my next video, I will be talking about thyroid disorders and its homeopathic treatment. Keep watching, stay healthy, stay blessed. Thank you.